When I was first diagnosed, it came as a bit of a shock because I wasn't expecting it. Simply because I was completely healthy and lived a full life the week before that, having gone to gym, worked out, played squash and done all my regular activities. So honestly, to be a asymptomatic positive case was quite a shocker. My experience is twofold. Mine alone was actually quite all right because I live in a fairly decent neighborhood. But I was taken with my father, and his was rather harrowing because he experienced what I would call the uninfective privilege, where his neighbors catcalled him and were very abrasive and nasty towards him when he was taken away. And this is something that we see, that people tend to think that it doesn't affect you or it will never come home. But it does, and this is something that we should think about when we speak about our social responsibility. Entering back into society once I was released from quarantine was a bit of a polarizing experience, in the sense the majority were very accepting and kind towards me or towards what I went through. But then there is the minority that is very concerned about whether I'm still infective or how much of an interaction I can have with them, and also once again thinking that the disease can never affect you. That experience led me to understand that people still have a fear of the disease and still have a massive misunderstanding or misconception of how it can spread or how it can affect you. When it comes to being diagnosed positive, there is what I believe, what I like to call a social responsibility that envelopes all of us. And mostly we think we may never get it because we are healthy, because we have a perfect bill of health, we don't have diabetes, pressure, any lung signs, anything. But it's not about you, it's about the people around you, the people that you associate. They may be in touch with somebody who's at the extreme of age, a very young child or a very old person, grandparents, pregnant ladies, people who have undergone chemotherapy, who have a compromised immune system. So you may not know the extent of your own reach. So that is where testing is very important. Simply because you are healthy or you don't have any symptoms and you're otherwise perfectly fine, it does not mean that the people around you have not been affected. And this is exactly the reason why we shouldn't fear quarantine, nor should we fear the disease. Because for you it may be a simple run to a quarantine center and back, but to someone who didn't know that they got it from you, it could mean a matter of life and death. So therefore it is always very, very important to test and test again.